Assalamu alaikum and good afternoon. This is a recorded lecture in case I'm not able to attend the conference due to internet problems and instability in Gaza Strip. Today I'm here to talk about an escalating crisis that is no longer can be described as a silent crisis amidst the catastrophic humanitarian situation in Gaza. It is antimicrobial resistance. Before we begin, we shall pay tribute to a group of dear friends and students who tragically were killed during this war. Sorry for that. Professor Muhammad Shubair, he's my role model and the first microbiologist in Gaza Strip. Uh, he was the former Islamic University of Gaza president for several years, and he's really has done a great work in antimicrobial resistance in Gaza Strip. Dr. Abdul Qadir Al Atul, who tragically died from heart attack going to his work during this war. Mr. Nahad Abdul Latif was bombarded with his family, and he was brutally killed with all of his family members, wife and children. He's also a student of mine. He's a microbiologist. Dr. Mahmoud Al Manama, he is my cousin, and he holds a PhD degree in microbiology and molecular biology. Dua Jadallah is also a graduate from the university with a medical technology bachelor degree. She was a very energetic person and intelligent one. Also, Wala Ayaghi was a student of mine. She was in the process of preparing for her master thesis. Before we start this presentation, also we have to share with you a story that is really recent and can describe the situation in Gaza Strip. The story is start with a former student trying to save her brother. He was severely injured on September 19th. She reached to me for help, hoping to get him abroad for urgent treatment. A network of people, including WHO employee, tries to do that. By October 6th, there was a hope. His name is on a priority list for traveling abroad for treatment. But then we learn the real problem. He has a critical respiratory infection. The lab result comes back as you see in the screen with Klebsiella, a common bacterium, which is luckily was sensitive to 3 antibiotics. I think the amikacin, colistin, and meropenem. And I told her that there is a hope because of the susceptibility pattern that is exhibited by the microorganism. Unfortunately, she informed me that the physicians has tried 2 of the antibiotics, which amikacin and meropenem, and there is no improvement. I told her still we have hope that amikacin will work, but few hours later she contacted me and told me that her brother just passed away. This is a crime done by the aggressors, the Israeli aggressors, and by the conditions that has created this situation. And many stories can be told with similar story to the brother of my student or former student. The ongoing genocidal war in Gaza has really intensified such challenges surrounding antimicrobial resistance, and maybe the issue of AMR is not new to the audience. Even politicians are now talking about AMR, not only the people in the medical field. However, in several situations, the magnitude of the problem has varied. In the third war, different from the industrialized war. In crisis affected areas like Gaza, the situation is really totally different from other areas which have some sort of stability. The crisis is known to be a major public health threat, complicating treatment options and leading to increased mortality rates. Uh, Simple wounds can be killing in case they are infected with antimicrobial resistant microbe. Thus, urgent actions are really needed to address the factors contributing to AMR in this region and safeguard public health, especially in the existing situation. Understanding antimicrobial resistance, we can say that antimicrobial resistance occur only when pathogens become resistant to treatment that previously were effective. Of course, there is a definition for innate resistance, which by default that the microbe is originally resistant to an antibiotic. This is called innate resistance, but we are talking about the acquired resistance issue. Many factors are affecting or contributing to antimicrobial resistance. Of course, these factors also vary from country to country, but more commonly, overprescription of antibiotics, misuse, either agricultural or human medicine misuse also. Poor sanitations can facilitate the spread of the emergent resistant strains. The global impact has been highlighted by many prediction models, and one model predicted that by 2025, 10 million deaths can occur from AMR. This number is much higher than those deaths that can be caused by cancer, by diabetic, and by hypertension and other diseases. Thus, we are proceeding to an era that is really beyond our control. They call it the post-antibiotic era, which is different, totally different from the pre-antibiotic era. Pre-antibiotic era, we still have hopes, and we have still sensitive or susceptible microbes. But with the post-antimicrobial or antibiotic era, the microbes are really resistant and with acquired virulence factors different from those pre-antibiotic era. The situation in Gaza can be described in 3 points. A healthcare disruption, the whole system either destroyed by the direct bombardment or by isolation, by transportation cutting, no access to healthcare facilities. Healthcare infrastructure was really damaged severely. It is expected that 80 to 90% of the infrastructures were destroyed. Increased infection rates, of course, conflict-related injuries have led to greater rates of infections, complicating treatments. Not only that, because we have also the overcrowding, the internal displacement, the famine that struck the people, the man-made famine, the intentionally man-made famine has lowered also the immunity with other factors like sewage and waste disposal, improper waste disposal and accumulation of this waste, all caused a burst of infection and infectious disease. Lack of surveillance, we really don't have sufficient data. You know, hospitals now are relying on a paper system for recording cases, and many patients cannot really also have access to healthcare. There was an estimation of 100,000 hepatitis A infection last year, and an estimation that was reported by the Minister of Health. But the estimation was either 300 to 400 cases, and the underestimation is resulting from underreporting of such cases, as I said, because either no proper medical recording or not reaching to the hospitals. With regard to the health system disruption, we can also discuss 3 points. Destruction of healthcare facilities as buildings and infrastructures, and many hospitals like the Indonesian hospitals, Al Shifa Hospital also, Al Ahli Hospital, even Nasser Hospital was directly hit by Israeli airplanes. This has resulted in destruction of hospitals and clinics. Shortage of medical supplies. All of you also are aware of the intensity of the requirement for treating one patient with blast injuries. Thus, there was a pressure on all the disposables and medical supplies with the blockade preventing new supplies. Hospitals really have that shortage of medical supplies. Also, the loss of trained personnel, almost 1,200 medical personnel were killed during this war, and many of them also have traveled abroad. So we have the healthcare professional either killed or imprisoned or traveled abroad or can't reach really hospitals. And we have to remember that healthcare workers are also human, and they require also food. Famine has really struck all the families, and many of the healthcare workers were not able to perform their job due to that famine. Overcrowding and sanitation and poor sanitation was very imminent for anyone who visited Gaza, or someone in Gaza can see it clearly. High population density in smaller area. This condition created the perfect environment for infectious disease spread. And if these diseases are caused by bacteria or viruses that are resistant to antimicrobials, then we have also a spread of AMR in that population. Lack of clean water. Access to clean water is severely restricted, leading to health risks. Before 2 months, a short study was performed and found that 80% of the drinking water samples that were tested are not chlorinated, or they don't contain residual chlorine in them, making them susceptible to contamination with sewage or other sources. Inadequate waste management. As I told you earlier, that we have mountains of solid waste that are located or situated near the population, with attracting insects and rodents and even animals like cats and dogs. These also contributors of disease spread. Increased antibiotic misuse was also noticed during this conflict because of the inability to access healthcare in many areas. People have resorted to self-medication practices, and of course, self-medication is one of the most contributing factor to antimicrobial resistance, because people usually take either short courses. I mean, they don't complete the course, or use leftover old one with lower activity of antibiotic, making the conditions for resistance higher. Prescription practices. When you don't have choices of antibiotic, sometimes you just prescribe antibiotic for patient to make them feel that they have got a care. And unfortunately, this is also common practice before even the war, but it was escalated in this war. Quality of available medication. We don't know about the storage of these antibiotics, whether the storage was proper. They are from different sources, from donations, from maybe they were exposed to heat during transport because of the lack of cold chain transport. All of these factors has led to increased antibiotic misuse. The impact of war on chronic diseases. Of course, the care shifted to blast injuries, which is life-saving, and it is understandable in such conditions. This shift has, of course, affected the non-communicable diseases. There's a psychological impact on the population, and it is really well known that psychological impact will lower the immunity for the people. Increased mobility among population. In one study not published yet, we have surveyed people in shelters. Many of them, maybe I'm not sure of the number, but I think it is more than 20% of the interviewed people has said that they were transferred more than 15 times. They were displaced more than 15 times during the 2 years period, and this also affects the general health of those people. Challenges in treatment: limited access to antibiotic. As I said, the supplies are really limited. Not only the supplies, but the quality and the types of antibiotics, the brands of the antibiotics, the classes of antibiotics are really severely affected. Inadequate medical supplies. I think I mentioned this point earlier. Resistance patterns, of course, because of the lack of infection control practices and the spread of many pathogens in hospitals. And hospitals were places for people who are displaced. So they build their tents in hospital. So the environment of the hospital becomes hospital and community. So you can't differentiate really between community acquired or hospital acquired. I think we have to prove that in research that we have contributed to the spread of resistance through this process of displacing people to hospitals. But of course, they have no choice. The public health consequences of AMR, of course, increased mortality rates, psychosocial impact, and economical burden. These are well-known and well-documented burdens of AMR. Response and recommendations. We have to strengthen surveillance. We have to re-establish the AMR surveillance. Before the war, we have started such surveillance program. It was not so strong, so not so solid, but it was in the process of collecting data from all hospitals and clinics about AMR, but now everything is out of order. Improving healthcare access, either by supporting healthcare infrastructure and ensuring the availability of essential medication, also can help mitigate the impact of AMR on public health. Also, we have to emphasize the public health awareness campaigns. I usually emphasize this point and say that we not only the public are requiring awareness campaign, but also our prescribers, who are the physicians in this case in Gaza Strip. They need to be refreshed with policies of antimicrobial resistance and antimicrobial prescriptions. Crisis of antimicrobial resistance in Gaza. We need immediate actions. We need international support. We really also need long-term strategies. Before this war, we used to celebrate the World Antibiotic Awareness Week, or World Antimicrobials Awareness Week as it was renamed. And we usually produce many posters and flyers with very attractive themes for all of the categories, either the public, students, farmers, poultry farmers, all of the sectors who are concerned with antimicrobial resistance. And those themes are no longer valid in Gaza Strip, and this year we really can't use them anymore. And we will tell you what our themes this year is so different, and it is from the reality that we live. They are bombing our hospitals. They are creating superbugs. So it is not really our fault this time. It is not. We can't do anything to stop this bombing of hospitals, and we can't really do something about the superbugs. In Gaza, antibiotic resistance is a deliberate man-made disaster, and as I told you, the conditions created by this war really the perfect environment for that. In Gaza, infection is the invisible weapon. Antibiotic resistance, its silence, a lie. Many patients died not from the blast, but from complication of the wound infection. How can we fight superbug when we can't even get clean water? When you talk to people about antimicrobial resistance, they tell, okay, give me food, give me water. So we don't have clean water, and we really can't talk about or fight even superbugs. No water, no medicine, no choice. A perfect storm for antimicrobial resistance. This is a well-said theme, but it really describes the harsh reality in the Gaza Strip as the pictures. These are real photos from Gaza Strip. We are being forced to break the rules of WOW. WOW, which is the World Antimicrobial Awareness Week. We really wanted to abide by the rules and to contribute to the global efforts in preventing antimicrobial resistance, but in Gaza we are really forced to break these rules. They ask us to be aware. We are really aware. We know everything, but we don't have choices. No choices are left. When wound can't be treated, infections become weapons. When antibiotics fail, humanity also lose, not only in Gaza, but everywhere in the world. My wow wish, this is a one physician wish for the medicine to work when it finally arrives. We don't have the medicine. If they are in waiting in Egypt or in somewhere else, they in storage conditions, they might arrive later, but when they arrive, they are no longer effective. Antimicrobial resistance knows no border. Like any microbe, they can travel with birds, with volunteers, with water, with everything. They can really leave Gaza to everywhere. And to complete the sentence, the suffering in Gaza today is a threat to global health tomorrow. Gaza, the world laboratory for the next global health crisis. I think what is happening here is a creation of a superbug that might not be found anywhere else, but it can originate in Gaza because it is really the perfect environment for emerging new diseases. The rules of health break down in war, of course, due to shortage and fear and displacement. The bugs are learning. Are we learning? I don't think so. This theme was written before the ceasefire, which we hope that it holds. Ceasefire is the most essential antibiotic, and the most effective treatment is ending the incubation. The incubation. Thank you so much, and I wish you a fruitful presentations and discussions in this conference. Assalamu alaikum.